What is capillary refill time? CRT. Capillary refill time is the time taken for color to return after pressing on a nail bed. The normal range is 2 seconds or less. What is the color code for biomedical waste sharps disposal? White puncture-proof container. What are common symptoms of stroke? Sudden drooping of one side of the face, weakness or paralysis on one side of the body, slurred or impaired speech, vision disturbances, loss of balance or sudden headache. What is normal blood pH range? 7.35 to 7.45. What are the early warning signs of sepsis? Fever or low body temperature, increased heart rate, tachycardia, fast breathing, tachypnea, confused or altered mental status, low blood pressure, decreased urine output. What are the early signs of hypoxia? Restlessness, anxiety, increased respiratory rate, tachycardia. What are the signs of a urinary tract infection? UTI. Burning sensation while urinating, frequent urge to urinate, cloudy or foul smelling urine, lower abdominal pain or discomfort, mild fever in some cases. What is IV cannula infiltration? Leakage of IV fluid into surrounding tissues. What is the most preferred site for newborn IM injection? Anterolateral thigh, vastus lateralis muscle. What is the difference between CPAP and BiPAP? CPAP, continuous positive airway pressure. This has one fixed pressure. It is used in obstructive sleep apnea. BiPAP, bilevel positive airway pressure. It has two pressures, inhalation IPAP and exhalation EPAP, used in COPD, respiratory failure. How do you check the placement of Rayleigh tube? Aspirate stomach contents and check pH, which should be acidic. Inject 10 to 20 ml air using a syringe and auscultate with stethoscope over epigastric area for whoosh sound. Confirm with X-ray if needed. This is considered the gold standard to check the placement of Rayleigh tube. What to check before administering blood transfusion? Patient ID, blood group match, expiry date, vitals, informed consent. What is the antidote for heparin overdose? Protamine sulfate. Give protamine sulfate IV slowly. This neutralizes the effect of heparin. What is C-reactive protein? CRP. C-reactive protein. CRP is a marker of inflammation or infection in the body. What is the normal fasting blood sugar level? 70 to 100 mg per dl for non-diabetics. What is the immediate nursing action in a patient with seizures? Ensure safety and protect the head. Do not insert anything into the mouth. Turn the patient to the side. Loosen tight clothing. Monitor airway and vital signs. Record duration and symptoms of the seizure. What is bradycardia? Heart rate less than 60 beats per minute. What is tachycardia? Heart rate more than 100 beats per minute. What are the steps to perform IV cannulation? Explain the procedure to the patient. Wash hands and wear gloves. Apply tourniquet above the selected site. Identify a suitable vein. Disinfect the area and insert the cannula. Look for blood flashback. Advance the cannula into the vein. Remove the tourniquet. Withdraw the needle carefully. Secure the cannula in place. Finally, flush the cannula with saline to confirm patency. What is the ideal position for a patient during rail tube insertion? High Fowler's position. Sitting upright at 90 degrees is recommended. It reduces the risk of aspiration. It helps with easier tube passage through the esophagus. What is the most common site for IM injection in adults? Deltoid muscle or ventrogluteal site? What is the importance of hand hygiene in nursing? Prevents the spread of infections, protects both the patient and the nurse. It is a key part of infection control protocols. It should be done before and after every patient contact. What are the different methods of oxygen delivery? Nasal cannula, high flow nasal cannula, HFNC, simple face mask, Venturi mask, which is also called air entertainment mask, partial rebreather mask, non-rebreather mask, which is also called high concentration mask, CPAP, continuous positive airway pressure, BiPAP, bilevel positive airway pressure, mechanical ventilator, oxy mask, a newer alternative combining benefits of nasal cannula and mask, tracheostomy oxygen mask for tracheostomized patients, TPs, used in weaning from ventilator and for tracheostomy, reservoir cannula, less commonly used but reduces oxygen waste, special mention devices, rare in some settings, aerosol mask, nebulizer mask, delivers humidified oxygen and medications, face tent, used for facial trauma or burns, heliox mask, delivers helium oxygen mixture in severe airway obstruction. What are the nursing responsibilities during blood transfusion? For full video link, message me on WhatsApp at the given number. If you like this video, don't forget to hit that like button.